The MacPro Help Desk team welcomes your suggestions for our training and reference materials. Please contact us with your feedback and comments on this training, or if you need other MacPro assistance. You may contact us via email at macpro_helpdesk@cms.hhs.gov or by phone at 301-547-4688.
Hi everybody, I'm Mira Wong. As Caroline mentioned, I will be providing an overview of data quality priorities for FFY 2020 core set reporting. These include the completeness and accuracy of the data reported, consistency between measures within and across core sets, and documentation of any changes in the data. Additional guidance on data quality can be found in the data quality checklists published for each core set. Links to these resources are included on this slide. We encourage states to review the checklists as you begin reporting and also to do a final check before submitting data. On the next few slides, we highlight a few priorities for FFY 2020 reporting. First, some states calculate a state level rate by combining rates across multiple reporting units, such as different delivery systems or managed care plans. We ask that you document the methods that were used. For example, when these reporting units use different methodologies for calculating measures, please indicate the number of reporting units using each methodology in the additional notes and comments on measures section in MacPro. States should also indicate whether the state level rates are weighted by population size under the section in MacPro called Combined Rates for Multiple Reporting Units. Additional guidance on calculating state level rates can be found in the technical assistance resource linked on the slide. Please note that similar guidance applies to the Health Home core set for combining rates across multiple providers to create a SPA level rate. States should document any populations and services that are excluded from their calculations of each measure. For example, states should document exclusions of beneficiaries within a program, namely Medicaid or CHIP, delivery systems, that is, managed care or fee-for-service, specific populations, such as dual eligible beneficiaries or individuals in foster care, and specific healthcare settings, such as those listed on the slide. If your state is unable to include some measure-eligible populations, please estimate the size of the excluded population and provide additional context on why these populations are excluded in the Additional Notes and Comments on Measures section in MacPro. States should also review the alignment between measures included in multiple core sets. One example is the follow-up after hospitalization for mental illness measure, which is included in all 3 core sets. States should use consistent methodology across the child, adult, and health home core sets, and we encourage states to report the measure for both the child and adult core sets and for the health home core set if applicable. We would also like to emphasize the importance of data documentation. States should document any deviations from the core set specifications, such as differences in age groups, data sources, and methods. States should also document any changes in the populations, denominators, or rates between reporting years. These data documentation notes will help CMS understand trends in your state's reported rates and may reduce the number of questions we ask when reviewing the data next year. States should also document whether measures were audited or validated and by whom. First, please specify which measures were audited or validated. Then enter the name of the entity that conducted the audit or validation, as well as whether the entity has any certifications. Finally, please specify whether the entity was internal or external to the state. These notes will help CMS understand the context of core set reporting in your state and will appear in related data products that summarize FFY 2020 reporting. We've provided an example at the bottom of this slide. For each measure reported, states will be prompted with the question, were any of the core set measures audited or validated? If you answer yes, please specify which measures were audited or validated and which entity conducted the audit or validation. We also want to note that the appendix at the end of the slide deck contains additional tips for core set data quality in MacPro. We encourage you to review the appendix after the webinar. Now I'll mention some technical assistance resources that are available to help states with their core set reporting. The hyperlinks to each of these resources are available in the slide deck, which was distributed before the webinar and will also be available on Medicaid.gov. We have developed a variety of resources for calculating and reporting measures in the child, adult, and health home core sets. I'll describe each of these resources for the child core set. The next two slides contain links to the resources for the adult and health home core sets. The first link shown on this slide is to the Medicaid.gov homepage, where you can find these reporting resources. Note that this page also has links to lots of other core set resources. Next, the measure list shows the 24 measures in the 2020 child core set, including the measure name, measure steward, and data collection methodology. The FFY 2020 Resource Manual and Technical Specifications contains general reporting guidance and technical specifications for each measure. The manual also contains links to the value set directories and medication lists needed to calculate each measure where applicable. The fourth resource is a summary of updates that provides the high-level changes for the measures in each core set from the previous year. This document outlines all of the changes to the measures that Caroline discussed today, as well as some other specification updates from the measure stewards. There is also a data quality checklist for each core set. This document is intended to help states improve the completeness, accuracy, consistency, and documentation of reported data. The checklist includes common issues identified in the data reported for FFY 2019. States should use the checklist to assess their data before entering it into MacPro. Finally, the measurement period table includes the denominator, numerator, and continuous enrollment periods for each measure. We encourage states to review this table while calculating a measure and again when entering the start and end dates for a measure in MacPro. States should enter the denominator measurement period on this table if they used core set specifications. And here we have the links for the resources I just described specific to the adult core set. And here we have the links for the resources for the Health Home core set. I wanted to mention one resource that is specific to the Health Home core set. The second resource listed on this slide is the Expected Reporting Table. This table provides guidance to states on which health home spas are expected to report for each reporting year. As you can see, we have developed several additional technical assistance resources to help states calculate and report the core set measures. The first is an updated brief on calculating state-level rates using data from multiple reporting units. This brief provides guidance for developing state-level or spa-level rates when data for the measures are collected separately by programs, such as Medicaid or CHIP, or by delivery system. We also have a brief on using the hybrid method to calculate certain core set measures. There are new fact sheets on calculating two measures: the admission to an institution from the community measure in the health home core set, and the controlling high blood pressure measure in the adult and health home core sets. There is also a fact sheet that provides an overview of the substance use disorder measures in the adult and health home core set. This fact sheet was updated for FFY 2020 and includes information about the new OUD measure. We also have an updated resource on calculating the plan all-cause readmission measure in the adult and health home core sets for 2020. This resource describes the updates that Caroline mentioned earlier. Also, programming software is available for several measures. First, SAS code is available to calculate the two contraceptive care measures that are included in both the child and adult core sets. Typically, the code can be found at the link on the slide. However, these resources are temporarily unavailable while the webpage is undergoing updates. In the meantime, you can reach out to the TA mailbox to request these resources. Software is also available for the 4 Prevention Quality Indicator, or PQI, measures in the adult core set and the PQI measure in the health home core set. ARC, the measure steward, has free software for calculating these measures available online. Please note that the ARC software calculates the measure per 100,000 beneficiaries, while the core set measures are reported per 100,000 beneficiary months. States will need to adjust the denominators for core set reporting. States can also request sample SAS code and a user guide for calculating the dental sealant for 6 to 9-year-old children at elevated caries risk measure. In addition, there's a TA brief for this measure available at the link shown on the slide. We also wanted to let you know about another technical assistance webinar we recorded in April 2020. We've provided links to the slides, recording, and transcript from the webinar. It provides more detailed information on changes to the core sets and technical specifications for measures in the FFY 2020 Child, Adult, and Health Home core sets, as well as available reporting resources. This slide has two important TA mailbox addresses. The first is for questions from states about calculating, reporting, or using the core set measures. The second is for obtaining technical help with the MacPro system. Please feel free to reach out to these mailboxes if you have any questions. Before we move on to the next section, we wanted to thank you very much for participating in this webinar. As always, if you have any questions, please feel free to reach out to the TA mailbox shown on the previous slide. Thank you again for your efforts to report core set data in MacPro and for all you do to improve the quality of care for beneficiaries in Medicaid and CHIP. I will now pass it to Avni for the next section of the webinar.
The MacPro Help Desk team welcomes your suggestions for our training and reference materials. Please contact us with your feedback and comments on this training, or if you need other MacPro assistance. You may contact us via email at macpro_helpdesk@cms.hhs.gov or by phone at 301-547-4688.